Moxi is a fractional laser that brightens the skin, polishes the skin, improves browns and reds, melasma in the skin, and happens to be one of the easiest lasers you'll ever experience. I'm Kathy Taranto, founder of AesthetiCare Medspa, a world's leading clinic. Today, I want to talk to you about Moxi. So what is Moxi? Moxi is a non-ablative fractional laser. Non-ablative means an easier wound, which means the body has easier downtime. Fractional means it doesn't treat the entire surface of the skin. It creates tiny micro channels on the skin, which again means easier downtime. So while we're using a laser on the skin, the downtime is simple or easy on our clients, and yet the result is amazing. So Moxi is a device that was created by Cyton. It's a manufacturer of Moxi, and Cyton uses or dials in a wavelength that's called a thulium device, or a 1927 wavelength. And so what that means is when we look at laser wavelengths, they have chromophores or targets in the skin. This one in particular targets water. So it finds water in the tissue, heats it up, and as that water is heating up in the tissue, it creates a type of wound. And that's where we get that non-ablative fractional wound. It's a wound that the body finds very easy to heal. So the downtime, instead of looking, really red and swollen for multiple days or up to a week, this is something where you might be pink for a couple days. You feel some texture on the skin for a few days. It starts to slough off while you're in the shower around the mouth and then the cheeks and then the hairline. And it's almost like your braces have been removed and your teeth are super smooth. The skin just feels so smooth to the touch. So it's one of those things that, yes, we have a little bit of downtime, but the instant gratification of seeing it come up and off is just one thing you don't want to miss. Who is the ideal candidate for Moxi? One of the beautiful things we love about Moxi is we really can treat almost everyone with this device. It comes down to who can we not treat. And so we do apply a topical numbing cream prior to the Moxi treatment. And so if there are any allergies with that, we would work around that piece. If you're pregnant, we're not going to treat anyone that's pregnant. But other than that, if you are a Caucasian client or you have melanin-rich skin, you're a candidate for Moxi. If you have melasma, you're a candidate for Moxi. And so while there's a number of technologies that we wouldn't use on our clients that have melanin-rich skin, this is one that can be safely done. One of the beautiful things about Moxi is that when you turn on the laser, Moxi isn't just Moxi. You actually are choosing settings based on the conditions in the skin and the skin type to get the safest yet most effective results. So we might look at someone that comes in and would like to see improvement in brown spots or pigmented lesions. And so Moxi's great at evening skin tone. We might have a client that comes in and says, my skin just looks really dull. I feel really tired. And this is a great treatment for brightening and polishing the skin. We may have a client that comes in and says, I've got these brown patchy spots and they happened after pregnancy, melasma. This is one of my all-time favorite treatments for melasma. And the beauty of Moxi is that it's not just for the face. It can be done on the face, the neck, the chest, the arms, the hands. We can do even full legs. So if you'd like a beautiful polishing effect, improvement in texture and discoloration, whether it's a pigmented lesion or even melasma, Moxi's a great treatment for you. What to expect from start to finish? At AesthetiCare, we always want to start or love to start with a consultation. It's really important to get to know you and for you to get to know us so that we can put together a customized treatment plan based on your skin type, based on the downtime expectations and the results that you're wanting to get. And so number one with Moxi is come into AesthetiCare for a customized consultation for you. Following the consultation, and you've decided to be treated with Moxi, we're going to have you fill out our client paperwork, of course. Following the client paperwork, we're going to double check to make sure on the day of the treatment that we've got your before photos, because the before photo really helps you to see the results as we go. We don't want to just say, hey, we're going to promise you we're going to see improvement, or promise you we're going to get results. We want you to be able to see the results along the way. And so the before photo is essential for treatment. So we'll make sure we have your before photo, and then we're ready to go. So step one of the treatment, day of the treatment, starts with clean skin. So you can come into AesthetiCare with clean skin, or we can do a cleanse for you here as well. Following the cleanse, we're going to apply a topical numbing cream. So one of the number one questions I get about most of our services is, does it hurt? And I'll tell you, some of our treatments, there is some heat involved. There's maybe a snapping involved. And so we really do everything we can to keep you comfortable. And so one hour prior to Moxi, we apply a topical numbing cream. It's a really strong numbing cream so that during the treatment, you feel very little. So we apply the topical numbing cream to the full area, so whether it's face, it's neck, it's chest. We leave that topical numbing cream on for up to an hour. Then we move you from our comfortable numbing space into our treatment space where we'll cleanse the topical numbing cream off, prep your skin for the laser treatment. So I always love to remind you about these steps on the day of treatment because if you're like me, once you get on the table and the eyewear goes on, it's like kind of a strange sensation not to know what's going on behind you. So we'll be thorough in doing this again with you on the day of treatment. So you'll come in, we'll cleanse off the topical numbing cream and we'll prep the skin for the treatment. Step one of treatment is that we apply eye shields to protect your eyes. And then again, that case you won't be able to see what we're doing. So eye shields go on. We are also wearing protective eyewear, and then we'll start the treatment. So we also have a device at our clinic called a Zimmer, and the Zimmer blows ice cold air. So if you think back to when you got your ears pierced and we use ice to numb the skin back in the day, that's what they did for me. We use that numbing device, that cold air. So not only have we numbed your skin for an hour, but we also have a way to keep you even more comfortable during that treatment. Although the treatment literally takes about 10 minutes. It's super fast. You're here numbing for a lot longer than you actually are having the treatment. So the Moxi device just rolls gently on the skin. Typically we start on the right side of the face. It rolls back and forth, it rolls up and down, and we're doing a delivery of energy based on patterns. And so your laser technician or nurse may say, okay, we're gonna do 6 passes, and that's typical for Moxi. So 6 passes would be just that, a pass up and down, a pass side to side, so that'd be pass 1 and pass 2. So 6 passes on the right cheek, 6 passes on the left cheek and around the mouth, 6 passes on the forehead, and then finishing up with the nose. And so as it goes, the first pass you don't really feel much, but then heat starts to build from pass to pass, which is why we use that cold air. Some clients tell me that on a scale of 1 to 10, 10 being the worst pain they've ever felt in their life, that it might be a 1 or a 2, and then we add the cold air and they truly with this treatment feel very little. So that heat starts to build. Once we finish one side and move to the next, we don't need to come back to that side. So we finish the full area. Once we've done with the Moxi treatment, which takes about 10 to 15 minutes, depending on how many passes and the size of the zone that we're treating, we finish the treatment with some post-treatment care. And that's really customized based on your skin type and the way that you respond to injury. So for example, if when you get bit by a mosquito, it swells up around the mosquito bite, that tells us that you have a high histamine response and you might experience more swelling than someone that doesn't. And so we've got some things that we can do here at AesthetiCare to really help minimize the swelling post-treatment. But we do apply post-treatment products to keep you comfortable, to minimize the downtime, and yet still get the most effective results that we can. So once we finish up with the treatment, we're going to go through your post-care kit with you. We want to make sure that anything that you're putting on your skin for a week after Moxi comes from us. So one of the complications that we see, really only very few complications from Moxi, is called contact dermatitis, which is basically an allergic reaction to something that's been applied to the skin post-treatment. So maybe you go home and you dip in your powder and you apply that powder to the skin. Well, your brush carries bacteria. Maybe you go home and work out, and what's on those weight or bells, transfers from the weights to the skin to the face. So we really want to minimize what's on your skin while the skin heals. And so we give you everything you need. We give you a cleanser, we give you a hydrating product, we give you a tinted sunscreen, so it really calms down what that downtime looks like, which I'm about to go into with you, so that it helps you to get through the process and it seems really easy is our goal. We include everything that you need in a post-care kit. In addition to that post-care kit, we even send you with a little fan because the skin is a little hot as you leave the clinic. And what I really like to remind you is that the heat, while it can be annoying, is actually what makes the treatment work. So that energy from that laser gets absorbed in water and tissue, heats it up to create the wound that gives us the result. So we don't want to dismiss it. We don't want to say, oh, no heat. It's just we want to keep you comfortable while that heat starts to dissipate post-treatment. treatment. So you'll leave AesthetiCare looking rosy pink, and as you're walking out the door, we give you also the option of taking home a cooling mask. So you can put that cooling mask on here and just relax in our numbing space, or you can take that mask home and watch a Netflix show while it cools down. So it takes about 2 hours to dissipate. About 25% heat goes away every half an hour, and then 2 hours comes by and it's like a light switch turns off, the heat just goes away. So once that heat goes away, you really don't feel it again. So the next morning you'd wake up, cleanse your skin, apply your cream. Next evening, cleanse your skin, apply your cream. And that's what you're gonna do for 7 days. So the skin goes from looking rosy pink to looking more bronzy. It feels like a really fine sandpaper has been sprinkled on the skin. And about 4 days, we start to see that slough off around the mouth as we're cleansing in the shower. And because of all the movement and oil we have here, it happens here first, and then it happens on the cheeks, and then it happens up by the hairline. And so that's just really natural. It just kind of spreads almost like a firework, how it comes off. So once that process happens, you can go right back to all of your skincare products. You can go back to your cleansers and your treatment serums and nourishing serums and your own moisturizers and sunscreens. But we really want you to limit what you use for the week of the treatment. Results can vary a little bit, but what I love about this treatment is that Moxi works. So whether you're coming in for brightening, polishing effect, or you're coming in to treat or suppress melasma, we love the results that we see with Moxi. So how many treatments do you need? If you're coming in for brightening the skin, polishing the skin, it may be 1 or 2 visits, and that's where we start you with Moxi, and we may follow up with other treatments like BBL or hydrofacial, but that is your treatment series with Moxi. If you have melasma, we're gonna put together a thorough 1-year plan for you that will incorporate Moxi maybe once or twice in that year, along with chemical pills and at-home products. And just a reminder is melasma, we are not able to cure it. We're constantly treating it. So it's a package that you would do every year with us to help your skin maintain that beautiful glow. I love Moxi for so many reasons, but just to simplify it, it's one of our clients and our team's all-time favorite treatments because it's one of the most effective yet safest in the market. For more information, go to worldsleadingclinics.com.